One of the things that has really taken off in dentistry, probably, particularly in the past 10 to 15 years, are what are referred to as dental implants. And people, many times it's like, well, what is a dental implant? The best way to describe it is it's a man-made root, tooth root, that is put into the jawbone. The bone integrates or connects to it, and upon that metal root, you now make a crown or a bridge or some sort of an appliance that anchors, gives you teeth back. And one of the things is that you always needed a certain amount of bone, a certain height of bone and a certain width of bone in order to place an implant, because they had a reasonable size to them. One of the really wonderful things that is evolving currently at this time are what are called mini dental implants. And what a mini implant is a scaled down version. It's a much more narrow diameter. Almost you could think of it as a decking screw. The beauty of a mini dental implant is I can place those in people's mouths in areas where I couldn't put a conventional implant because there wasn't enough bone. So it all opens up a whole new avenue. The other thing with the mini implant is characteristically I can place that mini implant and I can put a tooth on it or I can load it right away. In contrast to the traditional implants, typically what you do is if there's not, let's say there's not enough bone present. So what happens is we go ahead and we do a bone grafting procedure. We build up so there's enough bone there, allow that to heal for 3 or 4 months. Then we come and we put the implant in, and then we've got to let that heal for 3 or 4 months. And then we come back and do the crown or the bridge or whatever on that. The beauty of the mini implant is it's about half the cost of a conventional implant. It can be, we may be able to bypass the bone grafting procedure, and we don't have to allow healing time such that we can load it right, we can restore it right away. And the other thing is, you know, if you're going to have the bone grafting procedure, you're going to have the implant placed, you're going to go through these other surgical procedures, there's a certain degree of post-operative discomfort and pain associated with it. On the people that I've placed mini implants, when you talk to them the next day, it's like, it feels normal. I have no pain whatsoever. I've taken little or no pain medication. So anyhow, this whole area is evolving and opening up an enormous number of options for patients so that you can eat the things you want and you can have a nice smile and you can feel comfortable out eating with friends and relatives. You're not concerned about that denture dropping, flopping around, or you say, well, geez, I can't eat that peanut brittle, I can't eat that apple, or you've got to sneak away halfway into the meal and go into the bathroom, and many times maybe in the stall in the bathroom, you're trying to clean out your denture or your partial. You don't want to take it out where there's other people because you're embarrassed to be seen without teeth. So anyhow, the mini dental implant route opens up a lot of avenues for people that are missing one or more teeth, or all of their teeth for that matter. So, yeah, and you'd be surprised at what we can do in the short length of time that we need to do it. So if you have a question in regards to mini implants and what they can do, we want to hear from you, answer your questions, and maybe we can change your life. So thank you.